Well, hi everyone. This is Deidre Kindred, your nurse advocate on Health Chats Among Friends. And tonight I get the pleasure of talking with my good friend Beth Noah with the area on aging. But before we get into our chat, I'm going to ask Beth to introduce herself and tell us a little bit about who is Beth Noah. Beth?
Sure. Thank you so much for having me. My name is Beth Noah, and like Deidre said, I work for Area Agency on Aging, and we are with United Way of Tarrant County. So sometimes people will introduce themselves as working with United Way's Area Agency on Aging of Tarrant County. I've worked there about 12 years. And my position is as the coordinator for the Aging and Disability Resource Center. And so we'll get into a little bit more of what we do at the ADRC further into our discussion.
Awesome. Well, thank
Sure.
you for taking time out of your busy schedule, because I know it's so much you guys got going on, and I'm just so pleased and honored that you are willing to come and let us delve into a little bit about what you guys do. So I heard United Way, and I remember United Way when I used to work for a hospital that we could donate to United Way, but I had no idea what some of the things that the Area Development on Aging does. So let's talk a little bit about that.
Sure.
Some of the services that you can highlight.
Yeah, as I talk about Area Agency on Aging, we refer to it as the AAA, but it's not a car place.
Right.
I will say it as AAA just to kind of shorten it. So at AAA, they have a partnership with United Way. We're the only one in Texas that has that type of partnership. It is a different department within United Way, but what AAA focuses on is they help people 60 and older in Tarrant County. They provide services to help them stay in the home. So if somebody is a frequent faller, they might need grab bars in the bathroom, or they might need someone to come out and take a look at any kind of tripping hazards that they might have in their house, and they don't know that that's what that is, like any extension cords or any rugs that maybe aren't stable. They slip sometimes. And so that's what the service coordinators go out and they look at those types of things. And they have toilet seat risers. They have handrails that they can put like outside. They also can do ramps for people that use a wheelchair. So all these things are to help people, as they say, age in place. Like some people don't really understand that term, but that's kind of aging in place, meaning wherever you're at right now, you want to stay there, whether it's an apartment or your own home. These are things that help people stay in the community rather than having to go into assisted living or a nursing facility.
Right. Mm-hmm. So I think that's wonderful. So, wow. How does one find out? I mean, that's some great services, and I had no clue until I talked to you tonight. I knew you guys had did something else, and you did a presentation a while back, but it's like, okay, so if my mother or father or someone that I know lives in Tarrant County and they're falling frequently, do I just call you guys up, or is there a fee? Is there qualifications? I got so many questions.
Right. Well, all the services are at no cost. The only requirements are that the person be 60 years old and live in Tarrant County. And the reason for that is we do get money from Health and Human Services, and it has, that criteria on it. Okay. So now caregiver, they do help caregivers. They have some services that will help caregivers, but the caregiver doesn't have to be over 60, but the loved one or the person coming to get the services, they do have to be over 60. And what they do is when I mentioned that I also am the coordinator for the Aging and Disability Resource Center, that's where contacting us comes in. Because the Aging and Disability Resource Center, we have staff that answer the phone Monday through Friday, 8 to 5. We're contracted by Health and Human Services to do that.
Okay.
with the AAA, we have staff over at the ADRC. So we have this one state-free toll-free state number that we give out. And so if somebody's trying to get to the AAA and they want to get grab bars, or they want to know what services they have, they're also providing our number, since we do have staff answering the phone 8 to 5 Monday through Friday. And that number, and it is a toll-free number.
Well, before we get into that, because
Okay.
we're still, I don't want to, so, oh goodness, so many questions. So, so you grab bars and just different things like that. So what are some of the other services that you have? Because I know COVID has put a hindrance on a lot of folks.
Mhm.
So what are some of the other services that would come to mind?
Some of the other services, they do have, like those services are residential repair, the grab bars and the handrails.
Okay.
Health maintenance, and those services would be, they can supply somebody some incontinence supplies. It's not for a whole year, it's only for a few months. So some incontinence supplies. They can also do some durable medical equipment that I had already mentioned. They
Yeah.
do some, maybe if some people need to keep track of their blood pressure, like they might be able to get a blood pressure cuff. So it's different things like that to help people. Those things can be expensive. And so they want to provide those for people, but they go over the list whenever they do. We put people on their wait list. And so when the caseworker or service coordinator calls them, they will let them know what's available. And for caregivers, they have respite. However, it is only for people that are taking care of someone with dementia or Alzheimer's right now.
Okay.
And so
Okay.
there's a little bit of a new criteria for that service.
Wow, wow. So as I sit here and I talk with you, I'm like, oh, so many things that I'm not utilizing that I could be. So how does one, like, say hypothetically, you have a loved one, and do they just call the area agent and then say, okay, well, sign up for DME equipment? Like, say they need I don't know, blood pressure cuff. You were just talking about that. So is there an application or a process, or, so I heard
It's
waiting
just a
list
referral.
also.
Yeah, it's just a referral. And like I said, because we have more staff at the ADRC on manning the phones during the week, we take a lot of their calls and do the referrals, and we have a portal that we put them in. So we kind of screen them, make sure they're eligible. They do have to meet an ADL requirement of
Okay.
having at least 3 out of the 5 ADLs as a need.
So
And then
how do you find that out? How do you
we
have to go
ask
through a
them.
nurse or a caseworker? Or you
No, we just ask them, like we ask the caregiver, or if it's a single person that, we just ask them, do you use a walker? Do you have a cane? Do you need assistance with any kind of personal care? And so then they kind of tell their story or their situation. And so then it's just a brief assessment over the phone to make sure that they meet those basic eligibility requirements. So then all the referrals that we send over to AAA in that portal, then they know that have been screened for at least the basic criteria.
Okay. But how long does the process take?
They do have a wait list, and it depends on which program or which service they're getting. So we tell people it is about a 10 to 12 week wait.
Okay.
It's not, because of the wait list, it does take some time to get through. So about 3 months, I would say.
Okay. Yeah, that's pretty good considering some of these other wait lists that I know about. That's pretty decent. So, and I heard you say rest care for someone who has been diagnosed with dementia for the caregiver, right?
Mhm.
So how long does that process take, and where are you finding these caregivers?
Right. Well, that is an issue. And so vendors that they work with, and I think that wait time might be a little bit long for that. And it is term, it's not long term. It's not the long-term services and supports, the Medicaid or Medicaid waiver. through the state. This was only short term. It's a break for the caregiver.
Right. Wow. Okay. Okay. So then I know you got so many other things, and I'm trying to grab at something that I wanted to hone in on, but that's really key to know that, you can call for maybe safety rails or things like that. So who installs those safety rails? Like, say a client has been falling, they want some safety rails in their bathroom. Does someone come out and do an evaluation to measure?
They do.
Or
The case
wow,
manager, service
right.
coordinator checks it out, and then they have vendors. I think they have 3 to 5 vendors for the residential repair.
That is awesome. That is awesome. Oh, wow. So tell me a little bit more about some of the other services you guys have.
Well, also within the AAA, they have the benefits counselors. And so they go over people's Medicare benefits, especially if people are, say, 64, they're about to turn 65, and they have a book and they're reading through it, deciding on which options, what plan they want. Do they want an Advantage plan? Then they would be the people to talk to about that. They're not getting any extra money or anything like that. And so they're not going to try to push anybody towards getting certain Medicare Advantage plans or anything like that. They're just going to give them the straight information. So anything with Medicare, there's 2 benefits counselors there in that area, in that department. And then once again, they can either be reached directly, or they can come through us at the ADRC, and then we can email them or give out their work cell information. They're real busy right now since
yes, enrollment. Yes. Oh my goodness, that's amazing. So do you have any like classes for caregivers or anything like that?
Not right now. They're not having any. I think they might start looking at maybe having something, particularly with a partner agency. We have a branch that we do with THR and Alzheimer's Association, James L. West. And probably in the new year, they might look at some, especially caregiving type workshops and things like that.
Right. Now, so the DME equipment and the safety rails and things like that, you do not have to have Alzheimer's.
Right.
You can just be a high fall risk, or maybe you've been falling. So do you work with like primary care physicians for referrals? Because it's probably a crazy question, but I was wondering, how does someone get referred to you guys? Do you just, as a case manager or advocate, hey, call you guys up, I have a client that may need XYZ?
Yep. Okay. Emails, or they can call AAA directly. Sometimes the service coordinator might send us somebody to follow up and do a referral for, and so they just come anyway, mostly through the phone, and other social workers, they might know about us, or they give our card to somebody. Maybe we left cards at someone's office, and so here's the ADRC AAA number for you to call and go over what options are available.
Oh, that's awesome. Awesome. So it's well worth anyone's time who is dealing with someone who's over 60, just to check it out and see about the research, because it's not income based.
Right.
So anybody can call. So do you have equipment such as maybe like, I don't know, glucometers, or I know I heard you say raised toilet seats. Do you have, things like that?
Right.
Walkers.
Walkers, and they have manual wheelchairs. They don't have the motorized ones, but they have manual ones.
Oh, awesome.
The rollators, they have those too.
So where's the actual office?
The actual office for AAA is with United Way, in the United Way building in the north side of town. They are in the Stockyard area, pretty close to, it's on the red brick part. So almost at the corner of Main and what is that street? It's Northside Drive.
Oh, wow. Okay.
Northside Drive turns into, it's on Main Street in the north side. Yeah.
Now I want to go back real quick to the vendors, because I think about some people in mine already. Some of the people who may need a ramp.
Mhm.
So, but how long does that process take? Does it, that will be longer than 3 months, right?
Well, we don't know the specifics of, they just communicated to us, let people know it's about 3 months for all the services. Like I said, some start earlier and some take that whole time. And
Right.
just leave it to, we just do the basic screening for the service and make sure they're eligible. And also then when the case manager or one of the staff gives them a call, depending on what the service is, then they can give them a better timeline.
Okay, so you've mentioned case manager a couple times. So when someone calls, are they assigned a case manager?
Right. They will be, like, someone I think
Yeah.
initially calls and they do a further screening than what we do when we send it over to them. And then they're assigned a case manager depending on exactly what that service is. They do have staff that work with caregivers of people with dementia and Alzheimer's.
Mhm.
They would get the ones where that was the situation. And then it depends on people's caseloads also, as to
Yeah.
who's assigned.
Okay, okay. So that case manager would be assigned to them throughout whatever they need. Like say hypothetically,
Right.
if someone needed, DME equipment, and then later on they found out, oh, they need safety rails as well.
Well, and depending on
Would that be a
that's in,
different?
they do have to come back through us. So if somebody has services like maybe in March and all the services are finished by the end of April, but then in July, they decide, oh, I need something else, or now I want to they will have to come back through the referral process. And depending on the service, it's once every fiscal year. So that's something else that they have to keep in mind also, not to say
Yeah,
the
yeah.
service, but it's only typically if they've already completed and closed out their case, they might have to wait until that year comes back around.
Right, right. Okay, that's fair, because it's fair, because a lot of people are in need of aging in place. And that's something else that, I would love to have you back, and maybe within next year, and talk about aging in place. What does that mean? Because you and I understand it, but sometimes people don't understand, like, what does that mean? What is that? So I would love to have you back for us to talk about some of the things that we can implement so you can age in your place. I like to put your in there. Well, Beth, this has been great information. Is there anything else that you can think of that you want to add before we close out?
Well, one of the other services or departments that they have within the AAA is the ombudsman, and the ombudsman, they are assigned at the nursing facilities internally. And so they're advocates for people that are in a nursing facility. So if anyone is a caregiver and maybe they just put their mother somewhere in a nursing facility, and maybe there's some issues that they need to be worked out, whatever those issues are, they handle everything. And so they would also be referred to the ombudsman program within the AAA.
Oh, okay, that's good to know. That's good to know, because so you work with clients that are also in an assisted living or nursing care facility or something like that. Okay. So for those type of clients, say they needed some DME equipment that, I don't know, or reason that a facility wouldn't be able to go through their insurance or something. I don't know, I'm not sure. But that would be a reason to reach out to you guys as well.
Typically, whenever somebody's in a facility, they do provide that. Like if they're living and they need grab bars in the bathroom,
Yeah.
they should work with the assisted living place. And I would think they would do something like that. And most of the time, someone's DME equipment could come through a doctor's orders.
Yeah.
Something else that we suggest to people, if they need it immediately and they can wait 3 months, then if they go to the doctor and explain what they need, then if they get a prescription, then they can take that. But then sometimes if there's a copay with it, or the insurance will only pay a certain amount and they can't afford the rest, then that would be a reason they could wait for AAA services. And then sometimes people can't wait to get the grab bars, but they can private pay. So then we give them the vendor's information and they talk to that vendor directly and work out something with that vendor, and they just pay the vendor directly. Can't wait the 3 months.
Oh, that's good. That's good. Well, oh, good. This is just great information. I bet your website is full of information as well. So if someone wanted to find out more about area on aging, I keep leaving out the D.
Area. I know it's hard. Area Agency on Aging.
Area Agency on Aging.
Mhm.
Okay, so if someone wanted to find out more about, because you have so many other services that we don't have the time to highlight, but if they wanted to find out more, what is the best way for them to reach you? Or some of the best ways to reach you guys?
So the website, like I said, we are a partner of United Way. So we're on their website. And so it's United Way Tarrant, and that's all spelled out, unitedwaytarrant.org/AAATC/. So unitedwaytarrant.org/AATC/. And then that'll pop up on the United Way website, and then it'll be Area Agency on Aging. You'll see all the services, you'll see the criteria, you'll see the ADRC number so that you can call us directly Monday through Friday, 8 to 5. Any questions, you'll see a little bit about the history and just things that the AAA staff can help with. And we do the referrals. I don't think people can do a referral through their website anymore. That's specifically for us put in there.
Okay.
So, but they can call us, and then we would take a referral from caregiver, the person themselves, social workers.
Got it. Okay, so they contact you guys, and then you guys handle doing the referral and everything. That's good. That's good. That's good to know. Okay, and is there a number, or I know you gave the website, is there a telephone number maybe?
Sure. The number is going to be a toll-free number, and there'll be a prompt for Aging and Disability Resource Center, because we are taking the AAA calls, and that number is 855-937-2372. There's a small phone tree on there, so there's a couple of options, and so you'll want, when they say Aging and Disability Resource Center, do you want to stay in your home? Do you need services in your home? Then you'll hit that option, and then you'll be asked to enter your zip code. And so that's just to make sure that all the calls that we get are Tarrant County zip codes.
Right.
Good. The whole state of Texas for the ADRCs. So if somebody is actually on the phone in Dallas listening to this, they can call that same number, go to the prompts, put in the zip code that they're at, and get to their ADRC AAA.
Oh, I'm so glad you said that, because that was another thing I was going to ask. So thank you. Well, Beth, thank you again for your time. This has been very informative. And I appreciate you so much. And I need to start utilizing your services more. And thank you, everyone, for tuning in to Health Chats Among Friends, where we bring you reputable resources from our local communities. Tune in next time for another amazing chat with another amazing guest. Thank you again, Beth Noah.
Thank you. Have a good night.